Okay, Bismillahirrahmanirrahim. Assalamualaikum. Good day, everyone. For this video, we will talk about physical examination, the theory behind physical examination of cats and dogs. Yeah. Okay, just to start the session, to be a great physician, you must understand the whole story. What it means physical examination doesn't really going to stay on its own. It needs some information, some input, story from the history, and of course from previous medication history and what have you, for you to actually put it together with your physical examination findings in order for you to find out what's going on. If you were to interpret whatever findings from your physical examination only, you can be a good physician, but you will not be a great one. As Sir William Osler stated, good physician will treat the disease, whatever that you see, but the great physician treats the best, treats the patient who actually has the disease. So not just the disease, but the patient itself. So you can actually choose which one do you want to be, the great one or the good one. Okay, so to begin the session, I believe most of you are very familiar with this form. This is a patient medical record used in UVH UPM. All right. As you can see, we have minimum data about our client. And we do have a minimum signalment about our patient. So you have the species, date of birth, sex, type of breed, and even color. And of course, some history on the preventive medication, vaccination, deworming, and then heartworm prevention. These information will actually help you to narrow down your differential diagnosis later after you analyze your physical examination findings and of course history. Okay, so basically I would really on this form I like this bit so much, which is reason for visit, because it will give you some pre-information about whatever that you're going to find in your consult room before you even met your patient. Okay, so they will tell you straight that, hey, maybe it's a broken leg, or maybe because it's a systemic issue because the patient is not eating. So you can actually somewhat strategize on how you can conduct your physical examination. All right. And here's some bits and on management, and of course some area for history. But if you can see on the first page, the history was like so limited. So this is why the second page you have nearly half of a page for you to actually scribble on. Do a timeline on your history wise, when does it started, month number 1, month number 2, and so on and so forth. Okay, so then we carry on, go to the physical examination, whereby there's a column here for you to actually record the temperament of your patient. This is very important, especially if you're working on, in a very big establishment like UVH, because we do have a lot of VOs. And sometimes not, almost all the time, the case is not being seen by the previous vet on the case, especially if it's come in for another problem. So temperament will actually help you to understand your patient a bit more. If there's a previous visit, you can actually flick through and then see whether your patient is actually A-OK, or your patient is actually a flying type, very fractious or very timid, very scared. And over here, you can actually note the body condition score, sorry. So body condition score, whereby you can actually compare it to the previous visit, if there's any, to see whether is there any changes on the body condition score, dehydration status, the body weight, the temperature, pulse and respiration. Okay, if you can see this form, it's somewhat organized in a way that you will have to, and this form will remind you how many systems that you actually need to check during your physical examination session. All right, so NAF stands for no abnormal finding, and then ABN stands for abnormal. So you can just tick there if there's no abnormal findings, or you can actually tick below abnormal, and then you can actually describe what kind of lesion, what kind of condition that you actually detect from your examination. And then to follow through, you will have your preliminary problem list for you to actually, for your thoughts to be guided, for you not to miss any, abnormal findings up here, for you to list it down here. And usually we'll list together with the differential that we have in mind. And of course, these plans work similarly with the primary problem list. So if there's a problem number 1, so what will be the plan for problem number 1? You can actually list that A, 1A, 1B, 1C, and problem number 2 will be 2A, 2C, and so on and so forth. So if you manage to actually get your final diagnosis during this visit, so you can actually note down your final diagnosis down here, and you will put your credentials there. All right, and these are further details. Bear in mind, different places will have a different presentation of patient medical record. But if you look closely, most of them will have a similar criteria whereby all those minimum significant information regarding the patient, and of course, what are the findings according to system. Some of them, they like to do it in a drawing manner, whereby you can actually just choose which legs actually have lesion and how big is the wound. You can actually scribble through straight away. All right, you can feel free to draw some things behind here if you're good with drawing. Okay, so physical examination is a skill, so you have to be doing it a million times in order for you to be great at it. And the key to be, to learn as fast as you can is be consistent and thorough. Okay, never ever skip 1 or 2 systems because it looks pretty much normal from your general observation. All right, always make it a habit to actually see. The more you see the normal ones, the faster you will actually detect whether you're dealing with abnormality with your patient. All right. Okay, not to forget the must-have. What do you must have? For you to actually conduct a physical examination in cats and dogs. So you must have your lab coat, you must have your stats, you must have your pen torch or pen light, you must have your thermometer, and sometimes people do use otoscope to check ears routinely. So if you can have that handy, why not? All right. First and foremost, what you have to do is to back off. All right. Yes, you're very keen to actually touch your patient and then see what's going on or whatnot. But if it's not an emergency, all right, if it's deemed it's not an emergency, you have to back off and then do your distance examination. All right, or more or less, some people refer this to general observation. We usually do this when we actually get the history from the clients. All right, you will look at the gait and posture of your patient. You will look at the behavior, whether they're very scared, whether they're very a-okay, cats, whether they're purring, whether they're hissing. Mentation wise, you can actually see whether are they actually happy or they're very dull, or they're not responsive. Okay, Respiratory system, this is when you can actually see from far whether your patient can actually breathe in and breathe out properly. Is there any increased effort? Is there any increase in intervals? So, distance examination is the best time for you to actually count the respiratory rate before you even touch your patient. All right. Conformation and symmetry, you can actually start seeing all these while they enter the room. You can actually see whether they have any muscular dystrophy or muscular atrophy. One side may be bigger than the other side. Maybe the facial, one side is sloppy, one side is not. Maybe the ears, one side is droopy, one side is not. So those are the things that you need to take note. Body condition score, as I said, you can actually see it from far to begin with, but to actually get that preliminary BCS. But once you come to your close examination, you should be able to do, a palpation on the body for you to actually finalize your BCS for your patient. Neurological deficits, if, the complaint was your patient suddenly go blind. So this is when you can actually see, because the environment is not going to be a very familiar environment. So they start to bump into things because they don't know where things are. They don't know where the chair, where the desk, and so on and so forth. So you can actually see they're bumping into things, or if they having hearing deficits, you can actually see that it's not even responding. Okay. Visual deficits, and of course weakness. All right, it's either they can stand for how long, or they can just look at you and then that's it. They are not interested, or they weak, or what have you. So you have to have this kind of like preliminary list on what's going on with your patient. Okay, so for general appearance, like I said, body condition score. All right, coat condition. You can actually see whether the hair is actually shiny or not, whether, just by walking, you can actually see all the hairs falling off, dropping off. And of course, overall appearance, whether it's a happy dog, whether it's a very snappy dog, whether it's such a sad, cat, sad dog. So these are the things that you can conclude, just by looking at your patient. Body condition score, as I say, you can actually see from far, like the diagram here. So if you can actually see the severe abdominal tuck, and you can actually see a hourglass shape from aerial view, so it means that the score is 1. For teaching purposes, I will be using a 5-point score. All right, because if I go to 9-point score, because there's several point of scoring, it will be too detailed up to a point that you can't really grasp the difference between scale 1 and 2 and so on and so forth. So we stick to scale 5-point body condition score. Right. So this is score number 2. As you can see, as you can appreciate, it's slightly better compared to body score number 1. All right. With ribs, as I say, you have to, have a feeling when you actually do your close examination later. This is body condition score 3, whereby it's an ideal, body condition for cats and dogs. Well proportionate waist, easily felt with slight fat cover for the ribs. Okay. And they still have that abdominal tuck. It's not that you will not get a straight view, a straight overhead view. Okay. All right. So this is score 4, which is overweight, as you can, generally appreciate just by looking, from far. No abdominal tuck at all. It can be straight or it can be just a slight bulge. Right? And then this is obese. All right, so no waist at all. You can actually see fat hanging, from the abdomen, and then it's very difficult for you to actually feel the ribs when you do your palpation. Okay, So that's about distance examination, what things that you can actually see from distance. So now it's time for you to actually say hello to your patient and do your close examination. Do remember they don't know you. So first and foremost, you need to socialize. You need to introduce yourself properly. All right. So I believe you guys have been have been exposed to how to actually socialize with cats and dogs during your DVM1. Correct me if I'm wrong. And of course, restraining technique, it's been highlighted, and you guys been teach and evaluated during your DVM one. So I believe it shouldn't be an issue anymore, hopefully. And restraining, especially with cats, less is more. All right. So the less you restrain them, the more you will get from them. Okay. And you have to proceed slowly. You can go with system approach. You can go from head to tail. Okay. For whatever reason, whatever it is, you can, as long as, like I said, be consistent with your approach. All right. And the most important thing is, if your patient is, came in with a very clear issue where, for example, if there's any wound at the right hind leg, so you should be able to gauge that, right hind leg is very painful because there's wound there. So that will be the last place that you should go. Okay. So again, the same thing. If the eye is an issue, don't go with the eye first. Go and check on, other system first before you proceed with the eye, because it can be very painful, and that's about it. You will not be able to do a thorough physical examination for other system if you start with that first. For me, it depends. When it comes to TPR, which is temperature, pulse, and respiratory rate, it totally depends on, school of thoughts. For me, I always prefer for you to actually do it first before. Sometimes restraining and, your physical examination can be very much upsetting, so it will somehow, influence the readings that you will get. So usually I would advise to go for TPR first. And ultimately, if it's an emergency, please skip the routine PE. Okay, you don't have to, because hey, your patient is not breathing. All right. So, or hey, your patient is really, it's not conscious at all, whatnot. So there's other pressing things that you should be focusing on. All right. Okay, so these are the vital signs for cats and dogs. As you can see, the range are pretty much, overlapping with each other. So it shouldn't be an issue for you to remember this for life. For body weight, especially, so you have to know your breeds and, of course, their specs. Because, how many of you know, a normal body weight for a German Shepherd, for example? All right, what would be normal for German Shepherd? Because normal for German Shepherd can be very abnormal for small dogs such as Shih Tzu and Pugs and whatnot. Okay, so you have to know your breeds in order for you to actually know. And if you dig deeper, even temperature, respiration, and pulse, each breed will have their own normal range. But we're not going to go that, we're not going to dwell into that detail, because this is just a basic one. Okay. Perfusion indicators, of course, you will have to assess mucous membrane, whether it's pink, whether it's, very hyperemic, whether it's very reddened, or whether it's very white. And of course, capillary refill time. This is when you actually put some pressure at the buccal mucosa or at the lip, inner lip, so that you can actually see buccal mucosa or gingiva. So you can actually see time for it to actually be pink again. So this time lapse, we call it capillary refill time. This will somewhat give you the quality of the cardiovascular system. So whether the heart is actually pumping okay or not okay, whether your patient is actually in shock or not, all right? So mucous membrane, pink is normal, pale or white, obviously you're dealing with either anemia or very poor perfusion, heart issue, all right? Or it can be just a vasoconstriction because they're very scared of you, all right? So you have to know all that, okay? Like you guys always appear very pale whenever you guys need to present something. All right, so if the color is cyanotic, or some people refer it to blue, mucous membrane, so inadequate oxygenation, it can be due to hypoxemia. If it's very red, it can be, it can be due to congestion. You usually will see this, especially for heat stroke patient, okay, or patient that actually have fever or systemic infection. They can have yellow mucous membrane due to jaundice. They can have brown mucous membrane due to methemoglobin, which very popular, with an acetaminophen toxicity in cats. And you can actually have petechiae, red spots on the mucous membrane, which most likely due to coagulation disorder, right? Okay, so just for the sake of this theory session, so we go for, by system. So check the oral cavity first. So check the outer surface of the teeth, check the gingiva, the inner surface, mucous membrane, get the CRT, get the capillary refill time, and look at the condition of the gum, whether is there any gingivitis or not, the teeth, whether is there any tartar or what have you. You have to actually use all your senses, especially your nose, to smell whether is there any foul smelling, or sweet smelling. And when it comes to cats, this check underside of tongues for string foreign body. This especially for cats, because usually when they play with strings, somewhat, the string will be tied up at the base of the tongue. So you really have to open up their mouth and check if one of the complaint leads you to actually think that, hey, you know what, we're dealing with foreign body. So nose, basically you see whether both nostrils are actually working. You look at the philtrum, see, because usually when you deal with immune mediated diseases, they always go to this mucocutaneous junction. All right, and of course, if there's any discharges, if your patient is actually having some sort of upper respiratory infection, okay, like this fella, you can see the yellowish discharge, at the nostril area. Okay, now for both eyes, you have to, this is when you start using your pen light, because for you to actually check pupillary light reflex. Because if it's normal, at the moment you shine up the light at the eye, the pupil should be constricted quite nicely, all right? And Menis reflex to see whether, your patient is actually can actually see what's going on, or having issue on that department. So you have to check, upper eyelid, lower eyelids, and of course the third eyelid as well. Look at the symmetrical of both eyes, the color, and if there's any discharge, okay. Healthy cornea should be clean and very glistening, all right. So that's why I say you have to expose yourself and see, as much as you can, normal eyes, in order for you to detect, hey, that eye is not normal, something is wrong, okay. So same goes to the ears. You have to check, is there any inflammation, flip the ear pinna, check inside, see if there's any discharges, And again, use all your senses. You have to smell, see if there's any yeast smell, whatnot. Look at the ear pinning, then see if there's any crust. Like, in the picture, you have crust and thickening at the edge of the ear pinna. All right, and please do remember that cats will have a normal periauricular alopecia. Okay, it's normal. Why? Maybe I should do it as a quiz later. All right, so moving on. Now we're moving on to lymph nodes. So the most palpable lymph nodes for cats and dogs would be submandibular and popliteal lymph nodes. Okay. For prescapular lymph nodes, which is, prescapular, just before the scapula, you should be able to palpate. Normally, you should be able to palpate it in large dog. Okay. Axillary and inguinal lymph nodes. So axillary and inguinal lymph nodes, if you able to palpate it, it means that lymph nodes is reactive. That lymph nodes is big, so there's a crisis going on. All right. When it comes to submandibular and popliteal, it's normal for you to actually be able to palpate it. So in order for you to know whether you're dealing with a normal lymph nodes or not, again, you have to palpate as much, as you can, normal lymph nodes first. Because there's no such thing for me to say like, hey, you know what, 2 centimeter is normal for cat, 3 centimeter is normal for dogs, because it depends on the size of your patient. All right. Assessing dehydration. Okay. If usually we will routinely do a skin tan. So this is when you should be very consistent. Okay, if you start doing a skin tan, at the forehead of your patient, so carry on doing that. At the forehead area at any time you want to reassess or assess hydration status. Okay. If you keep on changing your location, your findings might not be correct and might not be consistent, so it's very hard for you to make relevant clinical judgment. Okay. So most of the time you should be able to assume that your patient is actually having dehydration, if there's any, around 6 to 8%, because usually if it reaches 10 to 12%, most of the time you will be dealing with a very shocked patient. Your patient will be in shock. And of course, if it's more than 50%, your patient, the chances for you to actually revive your patient back is very, very small. Okay, so respiratory system, you have to see, like I said, from distance, whether is there any effort in breathing, whether, the effort comes from inspiratory or expiratory. Okay. Is there any abdominal, abdomen involved? So you can actually see the abdomen is actually helping the lungs to actually, deflate and inflate to actually get all the air inside. All right. You have to palpate larynx, trachea, and palpate the ribs. Okay. Larynx and trachea, if your patient doesn't have any laryngitis or doesn't have any tracheitis, your patient should not be, appear choking or coughing after you do your palpation. Okay, when I say palpate, I really mean it. You have to palpate, so not grabbing. All right, so palpate larynx and trachea, just run through your fingers at the structures and then have a feel. Okay, whether it's inflamed, even the temperature at that area will somewhat, help you in order for you to actually make your whether to see whether your findings is significant or not. All right. Of course, you have to auscultate thorax. You have to auscultate at least 3 places. Okay. Thoracic cavity can be very small, can be very big. It depends on, what breed of patient are you handling. So I will always say at least you have to put 3 placement from each side. All right. So 3 spots on each side of the thorax, left and right. So in total, you must have like 6 spots for you to actually hear the lung sound. All right. You can actually visit this website for you to see, they have a very good auscultation library. So they share all the sound from normal to abnormal, sound, right? So cardiovascular system, again, when you actually do your auscultation for your lungs, you should be able to do, cardio. You should be able to hear the heart sound at the same time. But if you are evaluating a specific valve, you should be able to see, your anatomy have to be really good, and you have to put your stethoscope at the right area in order for you to actually hear and appreciate the valve sound. All right. Not just that, you can actually look at any jugular distension, and you can evaluate your femoral pulses while you listen to the heart rate, and then see whether do they actually synchronize, because they're supposed to. If they're not synchronized, if there's some, your calculation is off from femoral pulses to, your femoral pulse and your heart rate, it's either you're doing it wrongly or your patient is actually in crisis. Okay. So urogenital system, you have to check mammary gland, be it a female cat or dog or male cats and dogs, because male does have a mammary, they do have mammary gland tumor. You have to check all mammary glands. You have to check vulva for discharges or swelling. For male, you have to check the pubes, penis, and testicle. You have to extrude the penis out of the prepuce in order for you to appreciate whether you're dealing, whether is there any abnormality or not. Rectal examination usually will be done if you need to evaluate, prostate gland for your older patient. But while you're there, of course, you have to check anus and perineum area to see whether is there any, abnormality or anal sac disease. All right. So your anatomy have to be very good. Where there's the anal gland situated, in order for you to appreciate those structures. All right. Musculoskeletal. Most of the time, you should be able to gauge whether are you dealing with musculoskeletal issue or not at the moment your patient walks into the consult room, or for cats at the moment you actually release them or take them out from their cages, all right, or from their carrier. Okay, so if there's any abnormality, you can see some lameness or whatnot, then you should be able to do a palpation. See, if the lameness is due to soft tissue, or is it actually due to joints, or is it actually due to some bone issue. So you have to do this palpation. You have to palpate the muscle, you have to palpate the joint. For joints, you have to extend and flex the joints. And for bones, you really have to palpate, every single inch if it's possible. And if you feel crepitus, the cracking sound or the cracking feeling when you actually palpating, when you palpating your patient, it means that most likely you're dealing with fracture, be it a hairline, be it a complete one, or be it a whatever type of fracture that your patient is actually having. Okay. Integument, you should be able to assess integument concurrently with all the system that we've discussed earlier. All right. If you check in the thorax, of course, at that moment when you're palpating the ribs, you have to flip through the hair and then see whether, is there any papules, is there any red spots, is there any lesions, caps, or whatnot on that area itself. Okay. Same goes when you're at the head area, when you're at the, all four legs, and when you actually at the perineal area. And when you check, the mammary gland, you should be able to see the ventral abdomen area as well. Okay. All right. So when it comes to nervous system is quite special, because why? At the moment, if you feel that you're dealing with a neuro issue, all right, if you can actually appreciate these two picture, Okay, this poor little kitten, you know, the head, the necks all, you know, hyperextended, and then the legs are all hyperextended. Same goes, you know, to this dog, whereby the hind leg is, you know, very much extended and doesn't really give you the normal reflex, because dogs, if you actually flip their paw like that, they will correct it straight away. So for this patient, you know, he doesn't really know whether, you know, it's happening, you know, he doesn't register that. So it's a neuro issue. Neurological examination is a different game totally. So you will have more or less like 8 hours lecture on nervous system during your clinical veterinary medicine next semester, or maybe next, yeah, it's either next semester, first semester, or second semester during your fourth year. If I remember correctly, it will be in your fourth year, right? Okay, so abdomen, this is the most fun part usually for students, because this is when you actually get to palpate, and most of the time if you see videos, you know, you will see they are palpating things, and then they're palpating the abdomen. Okay, so when it comes to abdomen, again, when before you start, you have to inspect first if there's any distension, deformity, displacement, you know, whether it's symmetrical or not, whether it's there any bruising or what have you. Observe first. And again, I can't stress this further, do not grab. Okay, you just have to trace the structure with light finger pressure. Okay, imagine if your physician is actually grabbing your kidney. It's not going to be a nice thing, and you know, most probably you would feel that you want to slap that person straight away. Okay, it's very painful. Okay, so no. So usually you will go from spine, meaning that you will go from dorsal and you move ventrally. Okay, that's how you should actually do and trace the structures in the abdominal cavity. And again, your anatomy have to be 110% good in order for you to know and imagine what actually do you feel. Are you actually holding onto a kidney? Are you actually holding onto a urinary bladder? You have to know the location. You have to roughly know, you know, how does it feel, and how does it, how's the structure you know, look like, whether, you know, does it, you know, is it oval, is it like a balloon like structure, or is it like a tubular structure? Okay, so from spine, so dorsally, move ventrally, and then you have to, then you can actually move from cranial to caudal. All right, trace location, shape, and site of organs or masses that you feel. Whenever you feel there's a mass, or you know, there's a structure, big structure, always make it a habit to actually make a deduction whether, okay, is this mass firm or compressible. All right, does it feel like fluid feel? Does it movable or fixed? Or the surface, you know, is it smooth or irregular? So usually this description, this information will help you to tally your findings, your you know, your findings during palpation, or with your anatomical knowledge, and you know, see whether are you actually palpating a normal structure, or are you actually palpating an abnormal structure. You know, it can be a tumor, it can be a very gravid uterus, and so on and so forth. All right. The cranial abdomen, what can you palpate? You can palpate. If you're good, you can actually get stomach, liver, spleen, and some degree of small intestine. You should be able to identify, okay, this area is where pancreas belongs. So usually if your patient have some pancreas issue, pancreatitis, it will be super painful and you won't be able to actually touch the cranial abdomen at all. All right. Mid abdomen, what will you find? You will find spleen, kidneys, and small intestine. And caudal abdomen, this is where you will get urinary bladder, prostate, uterus, colon, and of course some part of small intestine. All right. So what can normally be palpated? Ventral aspect of the liver, left kidney, right kidney. For cats usually both kidneys. For dogs, it depends. All right. Urinary bladder, colon, small bowel masses, uterine horn, usually in big dogs, okay, and spleen. What cannot be consistently palpated, meaning that if you're able to palpate, something is wrong. All right. The cranial aspect of the liver, gallbladder, stomach, kidney, cecum, and intra-abdominal lymph nodes, prostate gland, adrenal glands, and of course, if you can palpate that huge, humongous blood vessel, posterior vena cava, and abdominal aorta. All right. So I think the video stops here. So I really hope that almost all of you can actually see this video. If you have seen this video, please ask your classmates to actually watch it first, so that tomorrow during the class we can have a very interactive discussion, and I can answer all the questions that you have, and we might throw some pictures and have some case studies. Yeah, and it doesn't have to be a 1 hour class. All right, see you guys tomorrow. Bye bye.